Hello and welcome to the Yale School of Management MBA for Executives panel to highlight the Pozen-Commonwealth Fund Fellowship in Health Equity Leadership. My name is Wendy Sung, and I serve as the Assistant Dean of the MBA for Executives program. I'm joined today by Dr. Howard Foreman, Faculty Director of the Healthcare Area Focus, Dr. Marcela Nunez-Smith, Faculty Director of the Fellowship, and Dr. Cecilia Calhoun, alumna from the class of 2021, and one of our 3 inaugural fellows. Thank you all so much for joining us today to hear about this fellowship at Yale School of Management and the significant roles of our panelists, fellows, and this program plays in solving for inequity within healthcare and dismantling structural barriers that exist within the healthcare system. Through them, you will learn about the mission of the Pozen-Commonwealth Fund Fellowship and its significance within the MBA for Executives program. We'll spend the next 40 to 45 minutes or so with our panelists, and we'll leave a few minutes at the end to answer your questions live. For those of you who may not be familiar with the Commonwealth Fund, it was established in 1919 by Anna Harkness with the mandate to do something for the welfare of mankind. The Commonwealth Fund promotes a high-performing healthcare system that achieves better access, improved quality, and greater efficiency, particularly for society's most vulnerable, including low-income people, the uninsured, and people of color. I want to take a moment to thank our panel of esteemed national healthcare experts for being with us today. I want to acknowledge where we are at this point in time with the pandemic and a 4th wave continuing to grip our country. Our panelists are incredibly busy and in demand, but committed to taking the time to educate us on this important fellowship to make an impact on healthcare through leadership. And now, without further ado, it's my pleasure to allow our panel to introduce themselves. And if we can start with Dr. Marcela Nunez-Smith.
Thank you so much, Wendy. It's just great to be here, looking around and seeing Cece and Howie and you and being in this conversation today. Thank you, everybody, for joining. So I'm Marcela Nunez-Smith, and I am just so proud to serve in the role as faculty director for the fellowship. I'm also a practicing internal medicine physician, and so I have a primary appointment at the School of Medicine, but really so happy to be part of the School of Management family. This has been, years in the making. It's wonderful to see where we are right now with the program. We're going to get into those details, but just really eager to be with you and answer any questions you might have.
Thank you. Dr. Foreman?
Yes, I just want to, highlight, first of all, I've been fortunate to know Dr. Marcela Nunez-Smith for, I think, 16 years now. I forget the exact number. We keep trying to check back on it. And she is ever so humble because in addition to those titles, as most of you know, she is also, I think, the chair of the Health Equity Task Force for the White House and the head of COVID, health equity. I forget all the titles for HHS, but it's been duly serving in government since the first days of the Biden-Harris administration, and has been serving our country ably since that date. And just today in the New York Times, there's like 10 quotes from her about the challenge that we face right now and the things that our federal government can do in coordination with the states and local governments to save lives during a very difficult time. So I just want to point out, and those aren't even the top 10 titles for her. She's got more, but could not be more proud to be affiliated with this program and to work with her on this program. I came to Yale 25 years ago as a practicing radiologist working in healthcare administration in the Department of Radiology. But at the last 23 years, I've been teaching at Yale, and for the last 20 years, have been affiliated with the School of Management, where I have co-founded the Executive MBA program and worked with Dr. Nunez-Smith to develop the Pozen-Commonwealth Fellowship a few years ago and continue to play an advisory role there. And it could not be more proud of our graduates. And I think that probably gives me a good segue to hand off to one of our first of our 3 graduates, Dr. Calhoun.
Thanks, Howie. I think both Marcela and Howie share that humility, and that one thing that's not captured in their titles is how incredibly and deeply committed they are to not just health equity, but the next generation of leaders. So I am the most thankful to be a part of this group. CC Calhoun, I am a lifespan hematologist. Both my clinical and research interests center around the care of adolescents and young adults with sickle cell disease. And so I'm thankful to be here at Yale University as an assistant professor in internal medicine and pediatrics and director of the Adolescent and Young Adult Sickle Cell Disease Transition Clinic. And yes, I am a recent alum and a member of inaugural class of Pozen-Commonwealth Fund Fellows.
Thank you. Dr. Foreman, you talked about founding the MBA for Executives program here at Yale. Can you tell us a little bit more about the inspiration to launch the MBA for Executives program with a focus on healthcare, and also sort of how the Pozen-Commonwealth Fund Fellowship came to be at the Yale School of Management?
Yeah, look, I consider myself one of the most fortunate people on this earth. When I took my job at Yale and started teaching at Yale, that was already more than I ever expected out of life. But what I learned when I started to meet with people over in the School of Management is that they really embraced their intention to serve a much greater good, not just developing leaders, but for service to community, to government, to society. They really meant it. And many people know that the origin of the School of Management was not even a business school. It didn't even offer an MBA degree until about 27 years ago or 28 years ago, when it converted from offering a master's in public and private management to a master's in business administration. But it has still continued to be committed to public and private sector alike, committed to social justice, health equity, among other equity. And so in 2002, when I was actually finishing up my time working in Washington, and the School of Management approached me about whether we might build a healthcare executive MBA program, I was excited about that. We had the foundational comparative advantages, so to speak, to be able to do something like that. And starting in 2003 and continuing till now, we have evolved from, a sort of new venture to a very mature, amazing product that now includes 3 tracks. And Dean Zung is the dean of the overall program. But the healthcare track, to me, is still the jewel in the crown. And so when the opportunity arose a few years ago for us to advance that even more by taking on the opportunity to educate leaders in health equity, I couldn't have been more excited about that. And Dr. Nunez-Smith knows well that I always tell the story as well, that literally like the day after I had the phone call about whether we might want to compete for this type of program, I was at an event with her and I leaned down and I said, I had the most amazing phone call, and if we can get this, we can change the world. And I still believe that. I believe that the program that we have now allows us to have a considerably larger impact than just one person at a time. There's a multiplicative impact in having a CC Calhoun, a Kenetha Gaines, a Crystal Yates, and many of our other current students as well, who can go back into their communities or work inside their communities to advance health equity, to educate others, and continue to advance this mission, because there is a lot of work to be done. It's not going to be solved in my lifetime, but it is something that we shouldn't defer. It's something that we have to tackle head on today. And the opportunity is, it could not be more obvious during this COVID pandemic. So I'll turn it back to you.
Yeah. So Dr. Nunez-Smith, you are the faculty director for the Pozen-Commonwealth Fund Fellowship. Can you talk about how the fellowship is designed to support leaders in health equity, and what you want the impact of this fellowship to be on leaders and within health equity?
Yeah, no, thank you. And I never get tired hearing Dr. Foreman kind of walk us through the origin stories of the fellowship program. I think it's something so special and unique. And and it's really wonderful that that those who are joining us are leaning in to learn more about this opportunity. And so, you know, from the very beginning, and of course, we're building on tremendous legacies here. You know, the legacies in the SOM program, the work of Commonwealth Fund, as you mentioned, and they've kind of long been committed to professional development opportunities in this health equity space. And of course, now with the tremendously generous gift from Bob Pozen to sustain this program over time. But you know, one of the core principles as we set out in this co-design process, and I really like to be very transparent with people and would love to hear Cece's thought on this. But you know, I think one of the exciting things about the program is we can continue to iterate and evolve and co-design, and it really is a customized experience for our fellows. But we have principles and values that we hold up and we anchor. You know, one of that is making sure that during this experience, people will have growth and see growth in their knowledge network. You know, this is one of the big challenges that we face, particularly those who are seeking leadership positions in health equity, is being connected, being in those various rooms and at the tables, right, where decisions are being made and where opportunities are being advanced. So we want to be sure that people will get an opportunity to both build in terms of skills and knowledge, and there is curricular design around that. Both the EMBA program, you know, for everybody who's part of the healthcare track will be learning about health equity and population health, but also a specialized design curriculum for the fellows to go through that is focused on those practical, pragmatic skills, but really fundamentally making sure that there is that peer support there, but that larger connection, you know, whether that be with leaders who are on a national advisory committee or beyond. So I want people to take away that all of us, we are here in service of your professional development. So we will listen and respond and design to get you to your goals.
Thank you. Dr. Calhoun, you were among the first cohort of inaugural fellows in this fellowship. Can you tell the audience that sort of what drew you to the Yale EMBA program and to this fellowship? What inspired you to apply?
Yeah, absolutely. So I am a physician scientist. I do clinical-based research for sickle cell patients. And as many of the practitioners on this call know, we know that we have health equity problems. We see that in our work every day. This is something that we are aware of and have been aware of if you are taking care of patients or interacting with patients or people in any way. And so for me, the question was, what do I do about it? How do I address it? Like, what is the skill set that I need to change this? And, you know, like Holly alluded to, this is a journey. We have a marathon of dismantling kind of these systems that have perpetuated inequities. And so, you know, I think understanding how to do that from a systems level, understanding and being in a space where you're encouraged to think innovatively, and then the bonus of having people who are sincerely invested in your progress, in your work, and believe in you, it was absolutely an opportunity I had to try. I had to at least try. And so that was my intention, but, you know, I cannot convey how much more my expectations were exceeded, how much more my the possibility of what I think I can do and will do has been expanded by being a part of not just the executive MBA program, but being a part of this fellowship.
Thank you. As faculty directors, Dr. Foreman, Dr. Nina Smith, can you provide more insight into sort of the type of candidates the fellowship is really seeking, and also within sort of the MBA for Executives program, and where you see the maximum impact from participating in this fellowship and in this EMBA program? And
I'll just go first really quickly and just
Yeah.
say, you know, it is a very competitive fellowship. And so we would love to engage with you as early on in your interest in this fellowship. Even those of you that may be too early to apply, we'd love to actually have contact with you. But it is a very competitive fellowship. Quite frankly, the EMBA program that we have here is already a very competitive program. And when you couple that with the added things that we've put in with the fellowship and the fact that it's funded generously both by the foundation and by Mr. Pozen, it becomes very competitive. So we want you to put your best foot forward and be able to tell us all the ways in which you're going to be a leader in this space. But make no mistake, like, we need you to be competitive both for the EMBA program as well as being a future leader in health equity, or better yet, an emerging leader in health equity. I'll let Dr. Nunez-Smith fill in more on what that means.
Yeah, no, perfect. Thank you so much. It is to underscore that the program is rigorous, right? The executive MBA program is a rigorous one. And I think, Dr. Calhoun can also speak to that. And really, I think you wouldn't want it another way. But we do have to be thinking at the very beginning about making sure people are going to be successful in the MBA program, and of course have the opportunity to optimally benefit from the fellowship. I would only add on from what Dr. Foreman said. We really do want to support and help people who are sort of right at that cusp, right, of emerging leadership. But we're looking for in the fellowship, particularly a track record, that commitment to the issues that are most salient in health equity. And health equity, the tent is big, so it can be coming from different sectors and different perspectives, but absolutely we're looking for that demonstration of commitment at every stage of your career up until the point of application, and seeing that trajectory for you to be able to take this fellowship as a launch and catapult for that next thing for you.
Yeah. Dr. Nunez-Smith, you had talked about a little bit earlier that there are other elements that wrap around sort of the core MBA for Executives program, which includes sort of the integrated core and the area of focus curriculum. Can you talk a little bit more about how the fellowship, what some of these extracurricular or co-curricular activities are, and how they move to train leaders in health equity?
Absolutely. And I'll just take a moment now to also talk about, I think, another great asset, or all the many assets really that are connected to this opportunity. And that includes the team, so, Wendy, thank you. I don't get an opportunity too often in public to do so, but thank you to you, to the incredible team at SOM that's been a tremendous home for us. I know I have said out loud before that, as a faculty member at the School of Medicine, primarily, I had a healthy degree of skepticism about a School of Management and a health equity program. And I have to say that it is embarrassing now, because the commitment is so deep, right, to the issues that we are focused on at the Yale School of Management. And so thank you to this team. Other assets we have, because again, we are able to draw on everything here at the university. So other schools, and including the School of Medicine, where I direct a research center, the Equity Research and Innovation Center, ERIC, and the ERIC family is so supportive too, as well, to the fellows. And even in our leadership team, we see here Senior Advisor, Dr. Foreman. There's an Associate Director, Dr. Rosanna Gonzalez-Colasso, too, who's tremendous. And Dr. Gonzalez-Colasso helps lead our Thursday night workshops, which is a core fundamental part of the curriculum, where we do bring in additional leaders, help build that knowledge network, while also building our community and enhancing that skill set. From the very beginning, Dr. Foreman, of course, brings just tremendous expertise and knowledge and wisdom to this process, helps us guide and shape these annual immersion visits. And we alternate taking a look really here in Connecticut at our policy leaders and landscape, and also looking nationally at the federal level and opportunities there. There's also a capstone project, which really is designed to help accelerate work that fellows are holding related to health equity, with mentorship and other supports to get that done. And we're always here. I think really we want to just lift up how important community is, and in an executive program, how much intentionality we bring to creating a community, even though we may be in virtual spaces like this or see each other, only a couple times a month. That's really important, and at the center of a lot of these co-curricular activities as well.
Thank you. Dr. Calhoun, you just went through the fellowship. I'd love to hear sort of how you feel the fellowship has impacted your work and leadership capabilities in addressing disparities in healthcare.
How much time do we have? I'm just kidding. So a couple of things. One, when I started the program, we were in person. This was pre-COVID that I started. So I had a year in person, and then all of our lives changed. And I mentioned a little bit earlier that I was able to really maintain a sense of community with the School of Management, with this health equity focus and purpose, and because of the fellowship, because of those Thursday night sessions. The space that was created where there are like-minded individuals addressing a major problem from different angles, and then also kind of going through this coursework with you together. It meant so much to me during a very, very isolating time when we were in a tough space. And to be able to continue to have growth during a pandemic is a gift. It is priceless. So I think, I cannot overstate how important this fellowship is in the context of the School of Management for emerging leaders. You need that community, you need that knowledge, you need that that support and encouragement from people who are where you want to be. So that's been incredible. So for me, in a more tangible way, I think, as you alluded to, the Commonwealth Fund is about systems change. It's about access. It's about quality. And I think that's echoed very much so, and is very much in line with the healthcare curriculum at the School of Management. My class is diverse in profession, and we are trying to figure out how do we function in these different spaces in the healthcare industry. And so I think that was really, really echoed in the coursework. And what the fellowship did was it gave me the space to explore my own ideas, visions, and dreams. And then at the same time that I'm getting that practical skill set to turn them into action. And, it's been incredible.
Thank you. So all three of you have been so committed to the program, to the fellowship, but you've been even more busy than ever before, especially this year. You've been in the spotlight with the pandemic. Dr. Nunez-Smith, you've been leading President Biden's COVID-19 Health Equity Task Force. Dr. Foreman, you've also been very visible in the media and through your Twitter at the Howie. What do you think? I'd love to hear what do you think has changed in health equity in the past 2 years since our inaugural fellows joined the program and in the year and a half of the global pandemic? And
whoever wants to go, I'm happy to go.
Why don't you get us started, Dr. Foreman?
Okay, for me, I've obviously been interested in this for a while, but there's never been a time that this has been central to the work that I do other than teaching. And for the last 18 months, it's been impossible to avoid. I remember being interviewed by someone probably 15 months ago and having them bring it up to me on radio, and I felt like I was adept at answering it, but it was just so devastating to realize how big of a problem this is, and how still, medicine, which has talked about this at times with lip service, hadn't done nearly enough. And over the last, whatever it is, 18 months now, we've started to make a little progress. If nothing else, we've pulled back a Band-Aid over a huge gaping wound that we thought that we could cover with a small Band-Aid. And it's a big wound. And at least now we're looking at the wound and thinking, what can you do for it? So diagnosis is one of the first big steps. To someone like Dr. Nunez-Smith, who has made this her life's work, this is a lot less shocking than it is to people who just never noticed it before. But for all of us, there's a lot of work to be done. And one of the things that I think comes up in all of our courses, healthcare and not, in the program, is how do we address this? And if we ever let our guard down for a few minutes, our Pozen fellows remind us. So it's an honor to have them here, but it's also a distinct advantage for us to have them here.
Yeah, I do agree so much with you, Howie, in terms of that collective witnessing that we've had. I mean, the sort of catapult into public consciousness that has really, I think, been important as far as advancing our dialogue, our shared understanding, perhaps some shared goal setting and other things. I mean, it is true. I remember kind of, you harken back to one of your earliest interviews in the pandemic. And I remember one of my earliest conversations with a reporter. And I think it was something akin to, those of us who are in this space are not surprised, right? By this predictability, right? In the pattern every time of who's going to be harmed first and harmed worst, right? And so it is, I think, important to acknowledge too, that this this is not a new area of inquiry or scholarship or policy, right? And for so many, and I look to many colleagues and many people in this space who have, for their entire careers and for decades and generations, really been trying to elevate and get us to this moment, I think, that we're in now. So the work is about meeting the moment. And that's what the fellowship is about. And so there is no better time, quite frankly, if you are interested and committed to immerse yourself really in the tools that you will need to be that kind of transformative change agent that we need. You know, this is what Dr. Calhoun said, it is about the next gen. And it is great privilege and honor for those of us who are part of the program leadership to be in service of that mission and in service of you and all that you can do and accomplish as a health equity leader.
I think for me, it's been this space to hold our society even more accountable, to be bold in the things that we say and that we do to address healthcare inequities. And I think that Dr. Nunez-Smith has always hit the nail on the head, because the timing is impeccable to have the skill set to move forward as doors are open for us as health equity leaders to be able to step in them with confidence, with support, with mentorship, with great sponsorship. That is the time we're in now.
Thank you. I just asked the audience, I'm going to move on to Q&A soon, so feel free to put any questions you may have in the chat. But before we do that, I wanted to ask the closing question of our panelists, which is, you know, sort of what is one piece of advice you would give to prospective students interested in the EMBA program and in the Pozen-Commonwealth Fund Fellowship? And maybe, yeah, maybe
I was
we
like,
can
is that
start
two pieces of advice? One for the
Two.
EMBA, one for the fellowship? Okay.
No,
Would they be different?
My advice for this always is talk to our current and former students. That's like, doesn't matter whether you're talking about the fellowship or the EMBA program, the best thing you can do to figure out whether this is right for you is talk to our alums and our current students. This is a very hard program. I mean, I sincerely mean that. We struggle with how hard it is sometimes, realizing that everybody is working full time and that this is a big commitment, and you also have a family and a family life and a life to go home to. The best way that you can know if you want to do the program and when you should do the program is to talk to our alums and current students, both in the EMBA and the Pozen program space. So I'll pivot away, but I keep grabbing the first comment.
I think that's right. I mean, that's great advice. There are no better experts, right, than the people who have recently been through it. So I echo that. I would only add, and I'll lean in more in terms of the fellowship piece of it, is, you know, as I said, we are really interested in helping people who are already committed and in this space, right? And thinking about what that next step for you is, what you're on the cusp of doing and achieving. But you know, we want to promote and support just authenticity in that. So I'm always just like, do not overthink this piece. You know, show up, be authentic, be genuine. You know, no need to be performative for any of us in this space. We really want to be genuine partners with you as you continue on this journey. So that's my piece of advice. And I have the best time in our interviews and conversations when people can kind of just show up and engage really authentically in this work and in this process together.
So I echo Howie's sentiments about the program being very challenging. So just to be like super clear, just know that it's a rigorous program. You know, this is not a online degree. So just, you know, be thoughtful about kind of where you are personally and professionally in terms of taking on that rigor and being able to learn. You know, you have this exposure to world-class professors that really actually care about your ideas and thoughts and can help you to be innovative. And in order to really get the most out of that, you have to give too. So it is hard. And so be aware, but you can do it. In terms of the fellowship, you know, I think we all have something to give to the world. So think about what yours is and show up as that person. And I want you guys to know that they are serious. Marcella and Howie are serious. They are committed to you as leaders, and that's a real, real gift. And so, you know, just just try. Okay. that's, you have to just try. So.
Thank you so much. Those are great pieces of advice. We do have some questions that are coming through. One is the fellowship only open to health practitioners, or is it open to others in the healthcare industry? And perhaps Dr. Noonan-Smith, we can have you respond to that.
Absolutely. So, I mean, you are, of course, on our conversation today, you are seeing featured clinicians, but the program is really intended for those who are making transformative change and are going to be making transformative change in health and healthcare space. And so certainly people who are close to the clinical mission and close to the clinical enterprise will have particular insights there, but it is not limited in any degree. And encourage you to take a look at the current fellows and the fellows who have graduated. I think we're really quite proud to see the diversity of professional training and interest and background in terms of who've been lucky to work with.
Thank you. Another question is, what challenges have healthcare practitioners experienced in minority health, and how does the fellowship train leaders to face these challenges? And
I can speak to my own experience.
Yeah.
I think there are kind of personal and then like organizational level challenges in both ways in navigating healthcare inequities as a person of color. I think being a part of a system that you see isn't really trying to help people that look like you is challenging for sure. What the program did for me was it opened my eyes about incentive alignment, operations, like how things work, and where it helped me to clarify where I wanted my impact to be and what I wanted that to look like. It is really skill building. And then the other thing is that community space with people who are having similar experiences, again, is invaluable. And then they hold you accountable. I was listening to this podcast about James Baldwin, and they were talking about how his criticism of the United States was a reflection of love for the United States, but it could be exhausting, and how he rejuvenated himself by having a community of scholars who did that similar work. And that's kind of what the fellowship does inside the program. And I'm not trying to be hyperbolic, but it's true. So.
Another question is there flexibility to do some of the fellowship remotely? Interested in hearing how moms of young children juggle the program. And maybe I can first take a first crack at this. The fellowship, or the MBA for Executives program, is an in-person program. We have what we call the extended classroom, which allows students to remote in for certain times, but it is not sort of a replacement for not being here in person. And to what Cece had talked about earlier, part of the fellowship is building this community, and the best way to interact and build this community, as we know, is in person, and then sort of remotely as a second best, right? Given what we had to go through this last 18 months. But I don't know if there's anything else you all want to add to that.
I want to add, exactly what you said, I agree with. I want to point out that the extended classroom has been a huge success in these very specific circumstances. We've had at least a half a dozen people, men and women, who by dint of the time of life that you're doing such a program have had newborn children. I remember the first one was way before we could even stream. It was probably 12 or more years ago now. And we would tape the sessions for her because she was at bed rest. I mean, it wasn't an option to come in. She was literally prior to delivery at physician ordered bed rest. And we were able to do that. And we've continued to be able to be accommodative of extraordinary circumstances when they arise, whether it's for motherhood, fatherhood, or other emergencies. But as Dean Sung said, this is critical that you are 100% in, both physically and mentally, to do a program like this. This is not a program where you're ever going to be able to skate by. I don't diminish at all the challenge that it is for so many people, whether it has to do with parenthood or not, for making the commitment to do this program. And one of the things that we're proudest about is that unlike a lot of other programs in life, you can choose when to do this program. You can do it when you're 32, you can do it when you're 42. There's a wide range. We've had students do the EMBA program as old as entering at, I believe, 59. So we want this to be the right time for you, and we will do everything we can to accommodate emergencies or life events that throw you a curve. But we do want you to be physically and mentally here every class weekend.
A follow-on question for Dr. Foreman. How have you seen the healthcare area focus grow and change over the years? For instance, has the mix of students in the area focus changed?
Yeah, so, first of all, obviously it's the best of the three focus areas. I just want to make that perfectly clear. It should go without saying, but I like saying it anyway. And it has changed over time. And quite frankly, by bringing the Pozen fellows in, by having 2 other local fellows that are fully funded through the departments at Yale, it makes it even more competitive because we have tracks that go into the healthcare area. What we've done over the last 5 years is we've introduced one course that had been asked for over a decade, and that was in health equity and basically population health and health equity. And Dr. Nunez-Smith teaches that course. That was probably the single best swap that we ever made when we said, if you're going to be involved in the program, we'd love to have you teach a course. And she said, I'll teach a course even if we don't have the program. So she started teaching this before we had the Pozen Fellowship. And it's been a highly successful class. She and I both teach at the same time. And so the students come into my class in the afternoon, sort of all excited about what they learned in the morning. So that's one big change. When we started the program, we didn't have a commitment to global health. Now we've been teaching global health for a decade continuously, and we'll continue to do that. And recently we pivoted our capstone class from being a more general business school capstone class to being a finance-oriented, investor-oriented capstone class. So we're always trying to round this out so that our students get the full gamut of experiences in business school and in health equity. And I think the program has continuously been made better, and Dr. Calhoun is our most recent graduate, and look at her now.
Those classes you named too are the highlights. Just to be clear, y'all, they are bomb classes. Not to be too casual, but they are good courses.
And Dr. Nunez-Smith, you teach one of the classes. How are you able to bring what you're working on a national level to the classroom and or to the fellowship curriculum and co-curricular activities?
Yeah, no, absolutely. And this is so much fun, and it's joy making for me to be able to do this. And Howie's right. I mean, this is just a couple of weeks ago in the rearview mirror that we went through and taught in person for in residence week. So so for those 2 courses, they are daily sort of consecutive classes. So it's really, I think it's quite wonderful because you don't have any time interruptions in terms of those conversations. But bringing in the federal perspective, particularly this year, I found valuable. I'm always the first to say I'm not going to squander an opportunity when talking to a room full of really smart and accomplished people to say, let's co-engage and think together. These are some of the questions we have right now, and so let's think about that. In the course that I teach, I actually co-teach it with Dr. Brad Richards, who is another graduate of the EMBA program, a tremendous person, somebody who's working, a leader in state policy, state Medicaid policy here in Connecticut. So it was, especially this year, being able to have the federal and state policy perspectives in the conversation at the front of the room and engage with everybody in real time questions and challenges. I think that's one of the most exciting things about population health and health equity is there is real opportunity to shape and change. So it's not a simple sort of memorize these 10 things, it solved these 15 problems. And that's really exciting.
Yeah. I mean, one of the things we talk about in EMBA, is that you learn something today and you can apply it immediately tomorrow. And it sounds like that's also happening with these conversations. So Dr. Calhoun, can you talk a little bit about how your fellows helped enhance your experience? And are they all very different from you in terms of experience? And if so, how that's impacted your experience?
Yeah, so as we were talking, as Dr. Nunez Smith was talking, one of the things about the program that's awesome is the variety of backgrounds that all my classmates come from. And so it changes the way that I think about the things I had usually been addressing. You know, when you have been had this one career, to have exposure and meaningful conversations with other people, it's wonderful. It's such a great time to be able to think with other smart people. Like, it's great. In terms of the fellowship, it is very clear to me how thoughtful Marcella and Howie have been in selection of the fellows. So I was the only physician in my class. Then we had a DMP, Kenitha Gaines from California, who was really like a powerhouse in maternal and infant mortality and healthcare administration in California. And then former deputy commissioner of EMS for the city of Philadelphia, Crystal Yates. And that was my class, you know. So we approached, there was so much synergy in the things we would talk about. And then the second year class that came in, Fatima Dreyer and Makai Owen, they just added to that. And so all of us were in different spaces, but learning from each other. I miss them. I still talk to them often because they're challenges that I face every day now that I want their perspective. You know, we're headed towards the same goal, but we're hitting it up in different ways. So
yeah, that's wonderful.
Great.
Yeah, and outside of the fellowship, there's a very diverse cohort of classmates as well, which adds to that experience. I know we're coming close to time, but before we close out, you may want to learn more about the admissions and application process. The application for the MBA for Executives program is now open, and the first deadline is in November. We will have additional webinars upcoming that will highlight the EMBA program and the application process. The best next step to learn more about the program and to see whether or not you would be a fit is to complete a pre-assessment through our website or email us directly at emba.admissions@yale.edu. We look forward to hearing from you, and I want to thank all of our panelists for taking the time to be with us today. It was so good to see all of you, and thank you to our audience members for joining us. Have a wonderful day.
Thank you all.
Thank you.